We are an inclusive group and open to new members working within a supportive network with a positive approach to co-production and engagement. We feel especially positive about this challenge as it is true co-production in action.
Co-production is possible when partners remember that in order for this group to work towards a goal, we need time to meet and plan. Co-production is not a tick box to say that the group has been consulted. Co-production is the investment of time, allowing the group to consult with each other, to debate and agree a way forward and make decisions following this process.
Any safeguarding adults consultation is incomplete without a customer forum. It is part of the jigsaw and creates the bigger picture.
We offer the lived experience to partner organisations to enable them to put reality into their systems. We are critical friends. We are equal partners in listening, discussing and assisting in the safeguarding process. We do not see challenge as criticism.
What is your role in relation to safeguarding adults?
Well, as a cabinet member, I'm here to make sure that obviously we ensure that all people within our city are properly looked after, protected, cared for. It's not just within our council services, but it goes beyond that as well to the services that we commission. But it's making sure that the most vulnerable in our city are properly cared for. I also think it's an important role that we have to make sure that we engage as much as possible, because it goes beyond us just sitting there and kind of checking things are done properly. It's actually listening, engaging and building on that so that people will come and feel that they can have confidence to share their experiences with us. So it's very much a listening role rather than just a kind of like checking role. I think we've had a real move forward on trying to push a kind of prevention type attitude, so trying to be there to stop things going wrong rather than having there just to react. So I think we've actually moved forward in acknowledging that that's kind of a whole approach that we need.
How do you know people are safe in Sheffield?
Number one, I think we react very quickly if we get any sign that we think there is a problem. We do try to react very quickly, and sometimes that's having to push partners to react. So it may be something, even if it's not directly our responsibility. I don't think that means we step back. So I think we can react very quickly.
What is your role in relation to safeguarding adults?
Right, well, I'm chair of the Adult Safeguarding Board, sometimes called the Sheffield Adult Safeguarding Partnership.
What do you think is your and the board's most significant achievement in safeguarding this year, and why?
I think we've just about bottomed the data and understanding the data, and I think we're seeing an improvement in performance.
How do you involve everyone in the development of the board?
Our main way is that we have a development day where we bring the board members together to look at what's happened in the past year and what's going to come up in the future, and then decide what the plan will be for the next year. And a member of the customer forum comes along to that meeting to help us think that through. We have a member of the customer forum who sits on the operational board to help us think about what the issues are and what we need to be looking at. But also when social care and colleagues are dealing with a safeguarding query, they do ask the person that they're dealing with at the start, what is it you want to get out of this, what will be success, and at the end they ask them, have your objectives been met, do you feel safer?
How do you safeguard people who are seldom heard because they don't know about the service, or afraid or ashamed?
It's very difficult, and one of my favourite phrases is it takes a community to keep people safe. So if we just relied on the professionals that were dealing with people to keep people safe, we wouldn't be able to do it.
What safeguarding training is available to you as the chair and to the board members?
So when I started as a chair, I had an induction programme, so I met all the different partners to talk about what their role was. So for this kind of work, it's not so much a training course as talking to other people doing a similar job and thinking it through. The board members who are in the main representing an organisation will also have their own organisation safeguarding training.
Who reviews the training material regarding its content and evaluation?
That's done through the colleagues who develop the training, but they also involve customer forum members in delivering that training, and that's a really important part of it. What we know is that if people hear the lived experience, it really helps them understand what lives are like for people and what the issues are.
How is the financial situation affected the way you do safeguarding?
It's not really affected the way we do safeguarding, because the safeguarding board, I think, is appropriately funded for the work that we need to do. But the way that the financial situation affects it is that increasingly there are not sufficient services to help all the people who need help, and the threshold for services gets higher as people try to make the money go further, and that's where the worry is.
How does the board ensure that lessons are learned from SARS safeguarding adult reviews in local and national?
Right, well, what we've established this year is a Safeguarding Adult Review Board, which I chair. So that meets 4 times a year, and what will happen with each review as we undertake it is then there'll be briefing sheets produced for people so they can understand what happened, what went wrong and what went right, which is always important, and then what we're going to do in the future.
What is your role in relation to safeguarding adults?
So I'm Phil Holmes, I'm the Director of Adult Services in the City Council. The statutory role I have, so that's the role in law, is the Director of Adult Social Services, and every local authority is required to have one of those. So I've got a statutory responsibility to make sure that adults in Sheffield are safeguarded, and the statutory responsibility for the delivery of adult social care.
What do you think is your most significant achievement in safeguarding this year, and why?
For me, safeguarding is about people feeling safer as well as people being safer. I'm proud that we're changing our policy and procedures around safeguarding this year to make them more accessible and more focused on the people we serve. I also feel proud over the last year that we're starting to increase when we survey people, they're feeling that the quality of support they get is better and making them feel safer.
How do you involve everyone in the development of your services?
Not as well as I should yet. So the biggest thing that we've been doing since the start of the year is our Conversations Count programme, which has been about taking away the bureaucracy that gets in the way of actually working with people and asking them what's most important to them.
How do you evaluate satisfaction from safeguarding concerns?
By asking people, but I think we need to do that on a much more systematic basis than we do at the moment. So I think making safeguarding personal would be about, first of all, understanding safeguarding in the terms of the person who was affected or felt to be at risk, and then to check afterwards with that person whether they felt that those concerns had been addressed or not.
What safeguarding training is available for your staff?
In relation to induction, people get support around safeguarding as a fundamental kind of point when they come to work for the council, and there is also safeguarding training available to adult social care staff. I think there's probably more that we can do, but I feel very reassured that we've got the range of training that staff need to be able to carry out their job roles effectively.
How are staff encouraged to come forward to improve safeguarding and the procedures?
I think one of the improvements we're trying to make is to have a bit more of a two-way street with staff. So I think that historically staff have felt like they're very bound by processes and their job is just to comply with a process or fill some particular forms out. Most of the ideas are with frontline staff, they're not with senior managers, because and frontline staff have the direct relationships with people in Sheffield and live in Sheffield themselves and understand how it all works.
What is your role in relation to safeguarding adults?
So I've got the executive responsibility and accountability to ensure that we've got an effective governance system for undertaking our safeguarding duties, that we've got a safeguarding team, and we have a lead professional safeguarding social worker by background and a safeguarding nurse.
What do you think is your most significant achievement in safeguarding this year, and why?
It might not seem like an important achievement, but I think our systems of how we understand that people need safeguarding, and then how we record the numbers of people that have been subject to safeguarding and why they are being safeguarded, and then following up those individuals and making sure that if they need inquiry, investigation, protection plans, that those are put in place.
How do you evaluate satisfaction from safeguarding concerns?
I think this is an area that we have to improve on, because we don't do it in a systematic way currently, so it's on an ad hoc basis currently, and one of our objectives for this year is around making safeguarding personal and being able to collate people's experience of being subject to being safeguarded.
How do you involve people who use your service?
So through our service user engagement team, we will be working with them to improve people's experience of being safeguarded, and actually how we involve people then in safeguarding decisions. But obviously as people are referred, then we will work with them individually and or their family that are involved. So it's on an individual level, but we don't report on that.
How do you safeguard people who are seldom heard because they do not know about services or are afraid or ashamed?
So that's through our staff, and that's their duty to notice, to identify, to recognise. So in a sense the staff have to advocate. They are there because they've got a duty of care to service users and patients, to speak up, to understand safeguarding and what it's there to do, and to, on behalf of those individuals, to speak up for them.
What safeguarding training is available to your staff?
We do trust-wide training, full day. We also do bespoke training at team level, and we also provide some supervision as well from the professional lead and the safeguarding nurse. And we're ensuring that all of our adult mental health community managers and ward managers are trained to safeguarding manager level. Mm-hmm. I do think from a board perspective, we could be putting together bespoke training that's for the whole city, for all providers, so that we're not all doing our own thing, and I think getting it to a standard.
And how has the financial situation affected the way you do safeguarding?
I think it's affected mental health services and the demand for services in general. We've seen an increase in demand over recent years. In terms of safeguarding, we are seeing increases in the numbers of concerns that are being raised, because I think, again, the awareness is there. And that's why we are looking at why it's really important that we've got an effective database.
What do you think is the most significant achievement in safeguarding this year, and why?
I would say, to be quite honest, the strength back in neighbourhood policing, I think, is really critical to the success. If we talk about vulnerable adults in locations, I think prior to neighbourhood policing being back firmly in Sheffield, then there was lots of people that were victims of antisocial behaviour, victims of abuse. We hear about cocooing, where people are taking over premises and dealing drugs. And I think all those sorts of things were really difficult for those vulnerable people in our communities to report. I think now neighbourhood policing's back in there, it actually acts as a buffer to actually build confidence with vulnerable people. I think also coupled to that is the fact that we've now recruited a hate crime coordinator for Sheffield. Every single week that we are pushing out what we call pop-in police stations, where people can see the police, go up to the police, and you can sign up to SYP alerts by those officers. They will do it automatically for you.
How do you involve everyone in developing of your services?
Okay, I mean, I think there's more work for us to do on this. I mean, you know, in terms of our bit, we run regular community consultation events with communities. We are trying to increase that. In terms of service design, we need to do more of it, to be honest, in terms of getting people together. We look at satisfaction of how sort of people are satisfied with the service that the police provide. So we've got follow-up surveys for people. We'll ask a series of questions so we can actually see how well we do that work.
How do you know people are safe?
I think it's a really difficult question for us, because people genuinely have a perception that they don't feel safe. The reality is that crime is lower than it has been many years ago. There are some types of crime that have increased. One of the things that affects vulnerable people is online crime, cybercrime and fraud, which is increasing.
What safeguarding training is available to your staff?
So at the moment, within our specialist teams, so that's the ones that work within public protection, there's lots of joint training that's ongoing, whether that's via the Safeguarding Board or via other providers. And we always encourage people to go jointly, so actually social workers, police officers, health professionals learn together around safeguarding. We have our own safeguarding training for police officers. So training for safeguarding is mandatory for all officers.
How has the financial situation affected the way you do safeguarding?
I think the financial situation has brought pressures on all organisations. Safeguarding for us is one of our number one priorities. We probably now spend more of our time safeguarding and dealing with vulnerable people than we do fighting the traditional crimes such as burglary and vehicle crime, etc.
So, what is your role in relation to safeguarding adults?
I sit on the board of directors, and I am responsible to the board of directors to ensure there are appropriate arrangements in the hospital and in the community in all our services for safeguarding adults.
What do you think is the most significant achievement in safeguarding this year for you?
So within the Trust this year, we've done an awful lot of work looking at how we make sure that people who come into our services as young people or who already may have some safeguarding issues are transitioned, as we call it, or moved safely into our adult services.
How do you involve everyone in the development of your services?
We have a range of ways of doing this. We use our various staff forum. We work with lots of different patient groups. We work with people with learning disability, people with sight issues, people from groups from different ethnic backgrounds to try and learn from them about how we best develop our services and make them responsive to their needs.
do we evaluate the satisfaction from safeguarding concerns?
So we have a team that take responsibility for safeguarding. So they work very closely with both teams within the council and other health trusts, working as a partnership on ensuring people's outcomes from safeguarding are monitored.
How do you know that people are safe?
From time to time we will know that things won't go as we would have wished, and so we receive feedback from patients, their families, carers and our staff through mechanisms like complaints or raising concerns. Our staff will raise incidents where they don't think things went as well as they could have done.
How do you safeguard people who are seldom heard because they don't know about the service or that they're afraid or even ashamed?
We do try as much as possible to do that. So some of the things, for instance, are where we think people may be subject to domestic abuse, we train our staff to raise the subject with people, because it's often easier to talk about it if someone's already introduced the subject and made it clear that that would be a conversation you'd be welcome to have. Equally, we do have some of our services that specialise in seeking out these groups and working with them.
What safeguard training is available for your staff?
Yeah, so we think safeguarding training is really important for our staff. So our staff are trained using a variety of methods. So online training is available for some people, which works well for teams, particularly our community teams that work out in community and have good access to laptops and other information systems. In the hospital, though, it's often easier to get groups of staff together and do it face to face. The training is mandatory. Staff are required to undertake that training every year, and we monitor the compliance with that training to make sure that it is happening.
Who reviews the training materials regarding the content?
Yeah, so we work in a partnership between our training department and our safeguarding team. Our training department obviously have expertise in training staff, and our safeguarding team know what kind of topics should be being raised. They will know that if there's been any issues in Sheffield recently that we want to reinforce, we can make sure that they are part of the training when it's refreshed each year.
How has the financial situation affected the way that you do safeguarding?
I don't think it has had a big impact in our organisation in terms of the safeguarding. We recognise this as important. It's something that we want to do well.
What is your role in relation to safeguarding adults?
Well, I work for South Yorkshire Fire and Rescue, and my role is safeguarding officer, and that actually covers both adults and children.
What do you think is your most significant achievement in safeguarding this year, and why?
My own achievement, I think, is to actually create a new safeguarding concern form internally. This, I think, has helped all our staff really understand what safeguarding actually is.
How do you involve everyone in the development of your services?
We're very mindful. We've actually got 2 equality and inclusion officers. One of the critical ways that we do engage with the community is we've got our customer services. But I think we're gathering a lot of information from all sources. We've also got a data team, so we can actually look at making sure that we're actually targeting what we do to the people that actually need it most.
How do you involve people who use your service?
We probably could be better at working with customers when we're actually looking at how we set off with services.
How do you evaluate satisfaction from safeguarding concerns?
It will be more the work that we do with regards to the multi-agency, going out and do joint visits with the social worker. So it will be feedback from professionals that we work with, as well as seeing that actually the service user that we've worked with is able to take on board the advice.
How do you know people are safe?
It's very much about when we've gone into their home. We've got a very detailed questionnaire going through looking at where the risks are with regards to fire. It might also be that while we're there, spending time with people, they might disclose all sorts of things.
How do you safeguard people who are seldom heard from because they don't know about the service, or they may be afraid or ashamed?
Like a lot of services, when people are hard to reach, we can't always reach them. With the prevention work, we are dependent on any other agencies, GPs, anybody from health, and we've got safe and well partnerships. But it works the other way around, because we may be the people that actually identify the people that may have been hard to reach, and then we actually flag up, nobody knows about this person, so we'll probably set the ball rolling.
What safeguard training is available for your staff?
Predominantly it is in-house. I like to go out and do face-to-face training to all our new staff.
How has the financial situation affected the way you do safeguarding?
I would say it's not affected the way that I do safeguarding, or our staff do safeguarding. In fact, it's a priority, and I think we've probably improved. That's not to say that we weren't affected by financial cuts. That's kind of service-wide. We work differently, we work smarter, service-wide, rather than offering everybody a home safety check. We're targeting it so that we're making sure that we reach the people that are much more at risk.
So what is your role in relation to safeguarding adults?
So my role is around ensuring that we provide safe care in Sheffield from the health perspective. So really, what that means is making sure that health providers, such as your hospitals and your GP, make sure we provide really good safe care.
What do you think is your most significant achievement in safeguarding this year, and why?
One of the things I'm really proud of is the work that we've actually done in GP practices. And what we've been able to do through the safeguarding team is really raise the awareness of how to ask questions when people present at GP practice, but also to understand what to do and where to refer people to.
How do you involve everyone in the development of your service?
So one of the key things that we do is actually work with Safeguarding Board and make sure that when we're looking at safeguarding provisions, that we actually make sure that all individuals are involved in that, whether that's around designing what we need to do or even understanding what services are.
How do you evaluate satisfaction from safeguarding concerns?
I think there's two areas from that, isn't there? So there's a satisfaction from the user, so have we actually been able to resolve that safeguarding concern? But there's also another aspect that people who raise a safeguarding concern, how do they get an evaluation from that, and what does that mean? So for example, GPs, if they've raised a safeguarding concern, we need to understand that they've understood what they've done, but also outcome from that.
How do you involve people who use your service in the development of it?
Health, I'd say, is working really hard about engagement and co-production. So we're doing a lot of public engagement, even before we start to review what services are, so we can understand what people are actually wanting and what they're needing.
What safeguard training is available for your staff?
We're very strict on safeguarding training, and it is mandatory training that we have to do. There's different levels that we provide. So even as people aren't governing body, so they're the ones that make decisions around commissioning, have to have safeguarding training. And that can be down to the any GP, it can be any domestic, any healthcare assistant. So all staff that manage healthcare in the CCG have training. But also what we do is we make sure that we put in our commissioning contracts to make sure healthcare providers such as GP or the hospitals also make sure their staff have safeguarding training as well.
How has the financial situation affected the way you do safeguarding?
It's going to get harder. Safeguarding, as I've said, is a priority for Sheffield City. What it means is that we have to get a lot more efficient, a lot slicker at working together. So for example, on Safeguarding Partnership Board, we've got police services on there, we've got probation services, we've got health and local authority, and collectively when you come together you're really having a better idea of what city needs. that isn't all us around money. It just means that you stop wasting money and start being more effective in what you're trying to do.
So what is your role in relation to safeguarding adults?
So I'm head of National Probation Service covering Barnsley and Sheffield, and I sit on the Safeguarding Adults Executive Board. I'm responsible for 4 offender management teams in Sheffield and the court team that supervise high-risk offenders, high-risk of harm offenders, and produce reports for Sheffield Court in terms of sentencing.
What do you think is your most significant achievement in safeguarding this year and why?
We have a number of work streams. I actually identify 2 in terms of the work that we do with offenders, because some of the offenders that we work with will present a risk to adults, to vulnerable adults and to wider adults. A lot of the people that we work with are also vulnerable themselves. So I would say that the key area where we've had a lot of input this year has been a partnership working around public protection and also prevent extremism. So we do specific pieces of work with people that are vulnerable or are considered to be a risk in terms of prevent extremism. We now have service user forum in Sheffield office and in Barnsley office, where service users meet and can identify different ways of working.
How do you evaluate satisfaction from safeguarding concerns?
So if we're supervising an individual that goes on to commit a serious further offence, there's quite specific criteria, high risk offences, murder, rape, the examples. Then we have an internal review process independent of the Sheffield office, but it is internal to MPS, that examines the practice in that case, talks to the officer and their line manager and identifies if there's good practice, which there often is, but also if there's any learning from the management of that case. So it could be in a scenario like that where there is learning in relation to safeguarding adults, safeguarding children, and all of that learning is looked at nationally as well to see if there's any policy implications. So I'd say that was a key area. We also do service user questionnaires on an annual basis. So we get feedback from service users about the quality of the service that we deliver in Sheffield.
Okay. So what safeguarding training is available to your staff?
We have a national package of safeguarding adults training. We also have a range of other training that's linked to safeguarding, so domestic abuse. A lot of the people that we work with have committed sexual offences, which means obviously they pose a potential risk to children and to adults. So we have a package of work which has actually just been refreshed around the work that we do with people that have committed sexual offences, a range, and obviously access to local training.
How has the financial situation affected the way that you do safeguarding?
Safeguarding is and has always been a priority for the NPS, the National Probation Service. So I would say it remains a priority, and so financial considerations haven't impacted directly. I think it would be fair to say that the provision of services for our service users on a wider level has probably been affected by the financial position because the other agencies have financial constraints, which perhaps means that the level of service is less than it used to be, and therefore sometimes offenders aren't always seen to be a priority group, so I would say it's probably affected the provision of services.
How many safeguarding concerns do you receive on average in a week?
It varies. We can get 100, we can get 30 a day. The most we've ever had in any one day was 60. But generally it's about 100 a week.
How has the development of the front door approach impacted on safeguarding?
What we try to do in the first contact team is we look at every concern that we receive We apply the 3-point test. And then we look at a solution at the lowest possible level.
What options are available to you to deal with the concern?
So when a concern comes in, it doesn't have to necessarily stay into safeguarding, because there's different elements of our teams where we can solution solve. We've got a prevention team, haven't we? So we can go out and visit people straight away. We can do a face-to-face visit, as I said. We can talk to people on the phone if that's what they prefer. We can look at something and talk around options of they may need a review or may need just a first-time assessment. And we try to do what's right. That's just the first instance, just having the conversation.
How are people kept informed of what is happening?
We always ring the referrer back, don't we?
Yes.
The person who's made the contact. We try to gain consent. We make sure that the person who's made the referral has the consent from the person who they are talking about. Usually it's the person themselves, so we straight to them.
What happens to repeat concerns? Do they receive priority?
If the concern was similar to what we'd received before, then yes, we would prioritise it, because otherwise, why is it coming in again? There's clearly a concern about that person.
What safeguarding training have you had, and how long after you were in post did you receive it?
I think that is very consistent, the safeguarding training. I think it's easy to go on. And different levels as well, isn't there? There's like awareness, you've got the manager's 3-day course, so there's a lot to choose from as well. It's very good.
Okay, so what is your role in relation to safeguarding adults?
My role is safeguarding manager, but what that means is that I have to look at the safeguarding cases and decide with the social worker what we need to do.
So how do you keep people informed about what is happening?
In the past, I don't think we've been very good at this, but now, because there's been a Care Act, there's new legislation, and we have to make sure that the person is very much at the centre of what we do.
What safeguarding training have you had, and how long after you were in post did you receive that training?
So when I became a safeguarding manager, which was about 5 years ago, I attended the safeguarding managers training, which was 2 days. I think it's good training, but I think what might be helpful is to have maybe updates or refreshers, or places where safeguarding managers can meet together to discuss particular cases.
How are team meetings used to reflect on safeguarding concerns and lessons learned?
We have a team meeting once a fortnight, and in a month, one of those meetings will be what I call group supervision. So it's at that meeting where staff can bring cases to be discussed, and often they're bringing safeguarding cases because safeguarding is quite complex sometimes.
What processes are in place to learn lessons from adult safeguarding reviews, and how have they impacted on day-to-day safeguarding practice?
Well, senior management do have lessons learned meetings. They might not just be safeguarding, there might be other issues as well that they feel need to be shared. So I have attended that type of meeting. I think the process from there is very much up to the individual manager, which I don't think is necessarily the best way forward.
What is your role in relation to safeguarding adults?
I am a safeguarding manager, so we get incidents that come through to us that should be looked at or investigated because they've already come through the first contact, which is the front door.
What circumstances might a safeguarding concern be progress when someone has capacity and does not want to be safeguarded?
That would happen if there would be a possible risk to other users. For example, if it was in a nursing home and there was poor practice that impacted on that person, we would then have a duty as an organisation to make sure that any poor practice was looked into, that we took learning from it because it would impact other residents at the home.
As a manager, how do you keep track of safeguarding cases in your locality?
I keep track because staff are required to come to me with any decision making going through that process, but mostly it will be through supervision, where I meet with staff individually once a month. I think what's really useful is we have a safeguarding clinic which is run by the service manager for any case that flags up as taking too long for whatever reason.
How is practice and procedures changed when they are safeguarding adult refuse?
The major one that I remember is a long time ago, but that brought about the vulnerable adult policy. So it's called VARM. That was the biggest change, and we all knew it as workers. We all knew what happened.
What is your role within the safeguarding process?
Okay, I'm currently based at the Adult First Contact Hospital team, so when I receive a safeguarding I'm predominantly screening it initially, so looking at what the detail is on it. Sometimes I may be contacting the referrer just to clarify a few details that's on it if something's unclear, and then obviously once I've sort of verified that information just with the person that's sent the concern in, I would then generally make contact with the person that it relates to, and you know, sort of have a little discussion with them about, you know, the concern that's been raised, go out to meet them and have a chat with them about what the concern is and what they want to achieve from that.
If you decide during an inquiry to exit safeguarding, how is that decision made? And is there an audit trail?
If we're exiting, we'd be discussing with the person that's at risk what their outcomes are, whether we've met them. But generally, at any point throughout the inquiry, we could exit. But just to be clear with the, you know, with the individual, you know, the process and to look at what support we can offer going forwards, because just because we come out of the inquiry process doesn't mean to say that we're going to stop supporting that individual.
If it is progress within a safeguarding, what does the process involve in practice?
It's about looking at what that individual's outcomes are, what they want to achieve, and it could be things like supporting someone to manage the finances in a different way that stops them from having the finances abused. It could be looking at supporting them to a change of accommodation if there's issues where someone lives. Sometimes we may be asked to do a particular inquiry into the workings of an agency, to actually meet with agency and look at records if there's been some concerns about the agency, or even a care home. We may go into a care home and do a bit more of a detailed inquiry in there.
How do you keep persons reporting, adults informed about what is happening?
I think we have to try and keep people as updated as possible, because, you know, it's important to that individual that the concern is being looked at and that they're being supported. So generally it could be around telephone calls if it's just a brief share of information. It may be that we need to visit that individual to share that information, or arrange to meet them somewhere where they feel safe.
What is your role in relation to safeguarding adults?
Okay, well, I chair the safeguarding outcome meetings, So first of all, I receive a set of papers from the Safeguarding Adults Office, and in that set of papers there will be the concern form, the face-to-face form and the planning meeting form, and then there is the outcome meeting form. So I can look back and read all of the information to inform myself or educate myself about the fine details of the case. So I'm prepared for any questions that might be asked at the outcome meeting. But I always make myself available 30 minutes before an outcome meeting to meet with the alleged person at risk or their family member or another representative such as an advocate. So if that person wants to come and ask me any questions or wants me to put questions to the outcome meeting on their behalf, then we have a little bit of quiet time so that I can put their mind at rest. It's my role as an independent chair to make sure that everybody's voice is heard at the outcome meeting, and we also invite the alleged source of harm.
How do you know people are safe in Sheffield?
The majority of outcome meetings, unfortunately, are usually about service providers, either home care providers or residential or nursing home care providers. So in relation to safeguarding outcome meetings, when we are trying to improve the quality of services, we would try our utmost to make sure that there was a representative from Sheffield City Council quality and performance team, and also, if it's relevant, a representative from the CQC Care Homes Performance Team, because it's very important that there are people, and this again is an agenda item, professionals within the meeting that can take actions away from that meeting and put them into immediate effect.
What type of abuse did you experience?
Financial abuse.
Who was it reported to? Who by?
It was reported firstly to the care company manager, and then the care company manager reported it to safeguarding.
Did someone come to talk to you face to face?
Yes. The social worker came to do an interview and find out what had happened.
Were you asked what outcome you would like?
No, I don't think I was. First time, because it's happened more than once.
Who looked into your concern?
Social services looked into it.
Did you feel involved in the process? Were you kept informed?
Yes and no.
What was the outcome, the one you wanted?
No. Well, the bit I wasn't particularly happy about is I don't believe the care company was honest, because I found out more information after, and they proved themselves not to be honest, because somebody else had been abused in the same time, and I think they should have told me that.
How would you rate your experience of the safeguarding process? If 1 is very good experience and 5 is a very bad experience?
I would rate it somewhere in the middle, about a 3.
How did the experience make you feel?
Neither angry or particularly satisfied.
Would you report a concern again in the future?
Yes, I have.
It was neighbourhood abuse. where I'm living. Well, I moved into the flat before 2 years ago, the flat I'm in, and I didn't know anybody, and I made a friend, so I thought, from across the road. And as it went on, she was conning me. It escalated, and I had to run away to Skegness for 4 days with a bag full of clothes and nothing else except a bit of money to get there. My daughter were worried about me. I was slept out in Skegness in the shelters. Sheffield police were saying to me to come back, and I thought I was going to be arrested and all sorts. And with me mental illness, I left my flat open, ran down the street and begged the shop to phone the police for me. The police come and I ended up in a mental hospital because of what she did. And I never got an ounce of help or support with it. And when I first met her, I thought she were a friend, but she weren't any friend. I want my freedom. I've always had my freedom, and I do not see why a woman should take that away from me. And I've been so upset over it all that I stopped coming to these meetings. I couldn't bring myself to come because I was ashamed of what this woman was doing to me, and I didn't know where to turn. I reported it to the police. I said I want to prosecute. They wouldn't let me. When your mind isn't right, you don't know who to ask. I ran down that shop with bare feet because I would not want a bully like that to happen to somebody else.
Horrible experience. First I went to for operation, and next day they dragged me out of bed like a puller to poles, and come through and came and said we had needle in my back, a fracture, and knocked it out the back. Never went to the poles, never said so or nothing. Nobody come back to me or nothing. I went to the pals, the pals.
Pals, yeah.
I went to them and this what's been happening.
Mm-hmm.
And I said to them, I need some support. Yeah, and she took it further, and I had no apologise, nobody come back to me or nothing. These people who've done this, it's gonna treat me more and more and more, and it put me over into hospital now. Not going back at all. Not gonna put my foot back in no more. Just pals, there's nowhere else to go to. Just I had no nothing from the power, and never come back to me, nothing. It's very hard, painful inside. Feel gutted, everything. And how they treat patients, I do not know. This woman said, oh, if I get this nurse says, oh, they get done.